Hi, everybody. It's Catherine here, and I can't believe it, but it has been 1 year and 15 days. Yes, 1 year and 15 days since I started my first 5-fluorouracil treatment. I did complete it 21 days later and have gone through a year's worth of healing. And on the recommendation of my doctor, we're going to do a round two, not because there's any one specific thing he's concerned about, but more of just getting, more precancerous cells killed so that I can prevent any future skin cancers. So I am only planning on doing a 14-day treatment this time, which is exactly the same thing that I had only planned on the last time. I did end up extending that treatment by another 7 days, and I'm glad that I did. I was a late bloomer. And for those of you that watched my full series on the treatment, I was doing morning and night videos to track the progress, the eruptions, the irritations, so that maybe it would help anybody else that was getting ready to go through this treatment in knowing what they might expect. And I was a very, very late bloomer with this medication. So I am very curious to see now, 1 year later, if I'm going to have that same thing, which is I really did not even start really seeing any skin eruptions until day 9, 10. And then it was a fair amount. Now, I have seen some YouTube videos where people have turned red like lobsters and have really had a difficult journey with this. And my 21 days weren't even remotely as bad as some people. So I always think it's good, just solely so that you have something to measure your own progress by and you don't give up too early. That's my fear, is that people think that they should be putting this cream on and turning red like a lobster and having all these blisters within a few days, and then it's not happening. And so they're just basically not doing the full treatment. And I think that's a huge mistake. This medication works differently on everybody, and we all have different backgrounds, we all have different cultures, we all have different sun exposures, and I think it's super important that you give this medication at least the full 14 days. Now, if after 14 days you're just kind of looking like I am right now, or you've just got a few spots after 14 days, that might be a time to say, you know what, I'm not as bad as I should be. But I mean, I would have that discussion with my doctor before I quit. And, and then there's the other side of the coin where you could be using this medication and, you just explode with, these blistering eruptions, and they're sore and it's itchy and it's uncomfortable, and it's not fun. I mean, it's altering your life for 14, 21, 30 days, whatever treatment time you're going to be on. And I think it's just really good to be able to see all of the different treatment responses, and so that you can get through whatever treatment time your skin really needs to have. So just as a recap for people that maybe didn't even watch any of my videos before, I'm gonna switch hands here, my arm's tired. I had to have a Mohs surgery on my face. And it was due to a basal cell carcinoma that was right here on my ala. I had been to the dermatologist religiously every 6 months for 30 years. And they would do the full body checks, they would do the skin checks, the whole thing. And anyhow, there was, I believe, a previous skin cancer here, a basal cell carcinoma, that in, I think it was about 2002, I thought I had a pimple here. And so I was just treating it like a pimple. And one night I was washing my face and a little piece of my nose literally washed off in the sink. And I was like, that's really weird, but I didn't think too much of it because I was still having some adult onset acne. I would working in the yard, that kind of thing, I would get some whiteheads or, just random pimples on my face. And so I really didn't think too much of it other than I probably washed too hard with a washcloth. And it started to heal. And then my next derm appointment had rolled around, and she saw the spot on my face, and she said, what happened here? So I told her, and she's like, okay, well, we'll just keep an eye on it. And that was pretty much that. And every time I would have a skin check, it was just one of those things where it would be mentioned again, and nothing. I mean, absolutely nothing. And we moved to Colorado, and I started seeing a new dermatologist and had the same conversations. In fact, I've had 3 dermatologists since moving back to Colorado, and nobody ever said anything about it other than, okay, well, we'll just keep an eye on that area. And that pretty much was that. Now, I have had a history of previous skin cancers, and I have, like many, many other people, have had many precancerous spots frozen off my face. So imagine my surprise in 2021, I went in for my skin check, and I was going to cancel that appointment actually and make it a few months later, and just decided, just get it done. And when I went in there, the PA actually did my skin check, and she said, I do not like this spot on your nose, and I think that I would like to do a biopsy on it. And I was like, okay, big mistake. Big mistake. If they want to take a biopsy of your nose, you better know ahead of time what type of biopsy they're going to take, because she took a rounded scoop out of my ala here, which is also cartilage, and that would have never healed properly. Never would have healed properly. It would have required plastic surgery, which ended up happening anyways. But at the time, I didn't know, because I'd had other biopsies before that, didn't leave, the indentation that she left in my nose. So regardless of whether I had skin cancer or not, I would have ended up at a plastic surgeon trying to figure out what to do with that mess. So I would seriously, if your doctor is talking to you about doing a biopsy anywhere on your nose, you better know and ask the questions about exactly what they're going to do and exactly how it's going to look and how it's going to affect the structure of your nose. That is golden advice, because seriously, if there had not been skin cancer there, my nose was damaged. I mean, it was damaged. So that's just something to keep in mind. Unfortunately, it did turn out to be a basal cell carcinoma, and I did end up having to have a Mohs surgery on my face, which was followed by plastic surgery to repair the nostril area. And in addition to that, they had to take tissue from my left ear, the cartilage out of my left ear, form a nostril, and for many weeks I had a large piece of tissue attached to my face right here. This incision was for the artery to keep the ear cartilage and tissue alive. So it's a serious freaking thing. And am I happy with the result of this? I'm not. I mean, I'm happy I have a nose, and I'm happy they were able to resolve, you know, the skin cancer issue. But had I known that this was going to turn out like this, I probably would have fought a little bit harder to find possibly any alternative treatments for that skin cancer on my nose, meaning, what would, starting with, for example, 5-FU do, or another drug like imiquimod. Maybe they weren't options, and I haven't asked that question since then because what's done is done. But let me tell you, it sucks. It really does suck. And it was a long treatment. It was physically disfiguring. It was emotionally, just still to this day, I just, so many things irritate me about that. But if you are being told that you can use 5-FU or Efudex in treatment, or as a treatment to eliminate any precancerous cells on your face, I don't know why you wouldn't do it. I just don't know why you wouldn't do it, because you don't want to end up with this. You really don't. And it's really sad. It really is. And I said last year that I would do a video on my skin cancer journey. And I will do that. I actually will do that this time. I think how I'm going to handle this 5-FU treatment, I'm going to do it in 5-day increments. Let me see. So we have 14 days. So I'll probably do it. Yeah, I'll probably do it in 2 5-day increments, and then, day 14. And I'll pop a video in that also explains the treatment that I have had through the years for different skin cancers. Because you have to advocate for yourself. You really do. And if you think for a second that going in time after time after time and getting, your skin lesions frozen is the answer to a potential future problem, it really isn't. It really isn't. Your skin cells are turning over all the time. Your skin is your largest organ on your body. And if you have had any kind of serious sunburning or jobs that you've been out in the sun, or you sat out there in sports watching your kids and you weren't protected and you'd come home with light sunburns, we all know what excessive sun damage is. And it may not necessarily show up in the form of searing sunburns. I mean, it just isn't always that. So you need to advocate for yourself, and you need to find out. They're not going to throw out 5-FU unless you are really seriously full of actinic keratosis, or, they've taken a couple of biopsies off your face, that kind of thing. You have to ask about it. And you definitely, next appointment with your dermatologist, ask is 5FU a treatment for me? Is it something? And then you do your research on it. It's not a fun treatment. For some people, it's really not fun. I didn't have as bad a time as some people, but I've had a lot of sun exposure and a lot of searing sunburns in my life. And I mean, obviously I'm fair skinned. I've got green eyes. That gives me even a higher risk. But it doesn't matter what your skin color is. It does not matter. You need to push for your own health and self-care to not end up losing half your nose, a portion of your chin. A little tiny skin cancer here can end up causing you to have a surgery that just totally, takes off half your side of your face. There's just no reason for not doing this. I think if you really, you just know, when you've got something just kind of brewing. And, when I think back to all the, okay, you look good. We'll see you in 6 months. Okay, you look good. Okay, we're going to do freezes. It costs you $199 to get 6 done on your face, or it costs you, $200 to get 9 done on your face, or whatever the thing is. And then you leave and you feel very confident and you're just thinking to yourself, whew, good, yay, that was easy. Maybe not so much. So anyhow, getting back to treatment number 2. I wanted to go back and do what I've always done on my videos. I've just taken a shower. My skin is completely clean and dry. And I'm going to give you a good look at what my skin looks like. And as you can see, I have melasma. I'm 63 years old now. And supposedly this right here is a vein that he's been checking. So we'll see if that's true. But anyway, I'm not sure how clear this is, but I can definitely tell you that my last treatment really got rid of quite a few spots that I had on my face. And there are some others that, like right in here, I'm very curious. These seem to be a little darker than what I remember. And I had a few down here. And then, of course, my eyebrows. That you definitely want to talk to your derm about before you do it, because it's really not meant to be around your eyes. I mean, it's a chemotherapy treatment, so you need to be extremely careful. And the medication it's ointmenty. It looks like a little bit like, do I have it in here? Let me grab the tube real quick. So this is what the tube looks like. And this is how much I still have from last year. And I know a lot of people put a lot more on. I was told to do just enough to lightly coat the skin. And that's what I did. But this is what the ointment looks like. Kind of looks like toothpaste. But it's got a little bit of a slip to it, so it smooths on very, very nicely. And then you put the fingertip of a glove. I cut one off of a latex glove. And then you just lightly coat your face. And when I do around my eyebrows, I literally do this. just right around my eyebrows, and then right down here, and then right through here. That was with the permission, and he was very reluctant to give me that permission. I will tell you that, because it is, closer to the eye. But I was insistent that I know that I've got precancers here. I know that I do. And you can still see, I've still got redness up there. So I most definitely am doing the eyebrow area again. This area right here, I must have had something brewing up there too, because it got very, very sore and crusty. I am going to definitely go a little more lightly in this area. This gets very, very sore. So in doing that, I think it's just best this time to go a little lightly, but I'm still going to do right in here the same way I did last time. I'm going to do my entire face the same way I did last time. And I am going to kind of hold off right in here until probably day 5 or 6, just because this starts drifting down, and this is what gets to the corners of your mouth. So, again, this is what I'm doing, and this is a second time treatment. So you, if you're watching this as a first time possible user, need to do exactly what your doctor tells you to do, so that you get the most benefit out of your treatment. And then I am right here going to avoid this area. This right here did not get much, too much eruption, but this spot went pew. It just turned red right away. So now it's, anytime I get like hot or whatever, it turns bright red. So I'm gonna not do that area, but we'll just see what happens. And hopefully the eruptions that I get are just for some additional little precancers that decided that, it's time for them to turn their cells over. And if not,